Surgical technicians are members of operating room teams and assist surgeons and nurses. They're responsible for preparing the operating room, sterilizing and setting up instruments, and for helping the surgeon, nurse, and anesthesiologist put on their sterile gowns and gloves. Surgical technicians also work with patients and prep them for surgery by cleaning and shaving the incision site. During the surgery, they monitor the patient's vital signs and hand instruments to the surgical team. They count surgical supplies like sponges, needles, and instruments. They cut sutures, and they care for, prepare, and/or dispose of material taken for laboratory study. Sometimes they operate lights or other machines. When the surgery is complete, they transfer the patient to the recovery room and clean up the operating room. Some surgical technicians get additional training and certification and become what's called surgical first assistants. They aid in hemostasis, that's controlling the blood flow, record the procedure in writing, and aid with anesthesia, and also they open packages for sterile team members. They're also the surgeon's right-hand man responsible for answering all his or her questions about the patient. Being a surgical technician is not an easy job. They must be able to stand for long hours and remain alert at all times. Obviously, given the nature of the job, they must also be able to tolerate blood, gore, and other unpleasant sights and smells. There's also the possibility of being exposed to contagious diseases. Training is in-depth and takes up to 2 years. The Commission on Accreditation of Allied Health Education Programs recognizes over 450 training programs across the country. Classes include anatomy, physiology, microbiology, pharmacology, professional ethics, and medical terminology. In addition to classwork, students work in a clinical setting and learn how to handle and sterilize instruments, prep patients, prevent and control infection, handle drugs and equipment, and ensure patient safety. Certification is available from the National Board of Surgical Technology and Surgical Assisting. Techs must graduate from a CAA-HEP accredited training program and take a national certification exam. To keep their certification, they must take 60 hours of continuing education every 4 years or retake the exam. The National Center for Competency Testing also offers certification. Techs must graduate from an accredited program and go through a 2-year on-the-job hospital program or have 7 years or more experience in the field. Certification must be renewed every 5 years. 71% of surgical technicians' jobs are in hospitals. The remaining 29% are in medical offices and centers that offer outpatient surgery. Job prospects in this field are good and growing rapidly. According to the Bureau of Labor Statistics, job openings for surgical techs are expected to increase by 25% by 2018, with the strongest job growth in doctors' offices and outpatient medical centers. Techs who are certified and willing to relocate will do best. According to a 2008 survey study, the median wage is around $38,080, with the highest paid techs making around $51,140 and the lowest about $25,490. With a large segment of Americans aging and the resulting rise in surgical procedures, this is a field which will offer a lot of job security. Please visit us at surgicaltechniciansalaryData.com for more information on surgical technician salaries and the training needed to get started in this exciting and lucrative career field.